I, Dr. Shagun, welcome you all for this Facebook Live session. We have Dr. A.K Dhar with us, a very renowned medical oncologist of a national repute with more than 30 years of experience. In next 15 minutes, we'll tell the audience about lung cancer. I welcome him on behalf of AI Gurugram.
Thank you, Dr. Shagun. I think you have chosen a very, very appropriate topic for discussion because lung cancer is one of the commonest malignancies, not only in India but also in the world also.
So what is lung cancer?
Lung cancer basically is a tumor in the lung and it proliferates, and if not treated in time, it spreads to other parts of the body and makes it stage 4 disease.
And so what are the warning signs and symptoms of lung cancer?
See, warning signs which may alert somebody are: one, that patient will have persistent cough for a long time, maybe for more than 6 weeks. Patient may have blood in the sputum. Patient may have breathlessness. And if the patient has this disease all over the body and particularly in the bones, the patient may have bony pains also.
And sir, what about the global incidence of lung cancer and about the scenario of this disease in India?
See, lung cancer has dramatically increased as far as the numbers of lung cancers are concerned. All over the world, the incidence is rising. And as per one of the international studies, we are getting about 2 lakh new cases every year. And in India also, we are getting about 70,000-75,000 cases per year, and the incidence is rising both in men and women.
So can you tell us who is at more risk of developing lung cancer?
See, the important thing is there are some certain risk factors which are responsible for causing the increased incidence as well as risk to the patient. And the most important thing is the smoking part. If anybody is smoking more than 2 packs in a year, this is called 2 packs per year. So the chances of getting lung cancer is high. So cigarette smoking is one of the commonest factor for giving the increased incidence to the lung cancer. Second factor is the environmental factor. Those patients who are exposed to asbestos or coal mines, they are at increased risk of cancer. And lastly, there is some familial tendency also, where those patients who have got familial lung cancer, they got increased chances of getting this disease as well. And lastly, I will say that there are few patients who receive, who are exposed to radiation or who receive radiation because of various indications. They are also at increased risk of getting lung cancer.
Sir, what about lung cancer in women versus men? Who is at more risk?
See, earlier, say about 3 decades back, the lung cancer was common in men. But over a period of time, the incidence in women is rising, and mainly it is because of the smoking factors and change in the lifestyle amongst the ladies. So I will say that the incidence of women is also rising, and they are just closing up with the men as far as lung cancer incidence is concerned.
Sir, we have seen people who don't smoke and still develop lung cancer. Can you please tell us a little about it?
I'll give you little statistics about this. I'll tell you that 80% of the smokers who smoke, or those patients who are detected to have lung cancer, 80% of these people will have lung cancer. But there is an entity called non-smoker lung cancer also, which may be because of the various reasons. So it is not a universal law that patients who do not smoke will not get lung cancer.
Moving on to the next question. Sir, what is the criteria for screening of lung cancer?
See, screening of lung cancer is very important. Why we do screening is because we always want to catch the disease at the earliest stage. And more you catch the patients at earlier stage, chances of getting cure is very high. So we should start screening patients so that we catch them at early stage. So there are two indications for cancer screening, lung cancer screening. One is age, that is more than 50 years of age, and those people who are smoking, if they are smoking more than 20 packs per year, there are increased chances of getting lung cancer. So these are the two broad indications for getting cancer screening. I think the screening should start after the age of 50 years, particularly in those people who smoke.
Kindly tell us about the staging of lung cancer.
See, there are 4 stages. Stage 1, Stage 2, Stage 3 and Stage 4. Stage 1 disease is when the disease is localized within the thoracic cavity and it is in one part of the lung. Stage 2 is when it is involving the other side of the lung also. And Stage 3 is when it goes beyond the thoracic cavity, but it is within the pleura. And Stage 4 is when it is spread all over the body and particularly involving bone, liver and brain and other parts. So this is how the staging is done. Staging is important from the point of view that depending on the stage of the disease, we decide what treatment has to be given to the patient.
Sir, kindly tell us about the treatment options of lung cancer.
See, there are 3 modalities of treatment. One is radiation therapy, second is surgery, and third is chemotherapy. But recently there has been trend of including immunotherapy as well as targeted therapy for the treatment of lung cancer. So what we do is that the early stage lung cancer, we subject the patient to surgery. And what is early stage is, that is Stage 1 and Stage 2. And when the disease is little more advanced, we combine modality of treatment with chemotherapy and radiotherapy. That is in Stage 3, almost Stage 3 diseases. But when it goes into the advanced stage, we give the patient to systemic chemotherapy. Now, this systemic chemotherapy can be in the form of chemotherapeutic agents, it can be in the form of immunotherapy, it can be in the form of targeted therapy. So these are the various methods of treating the lung cancer patients. But the most important thing is, as I told you earlier also, catch the disease at the early stage, treat it surgically, and if possible, it is not treatable by surgery, give chemotherapy, immunotherapy, targeted therapy and radiotherapy depending on the indication of the disease.
And sir, how the treatment of lung cancer has changed from in last 2 to 3 years?
When I joined oncology way back in early 90s, the treatment of lung cancer was very limited. There were only 5 or 6 therapeutic agents. Radiotherapy was there, but not of this standard. The targeted therapy was not there. Immunotherapy was not there. The important surgical techniques which is nowadays used, these techniques were not there. What the researchers have done in last 2 to 3 decades is that these people have come up with very important therapeutic agents like immunotherapy, targeted therapy. And what these agents have done is, not only they have improved the survival of the patients, I will say the survival has improved by 25 to 30% in last 2 to 3 decades. but also it has decreased the side effects and toxicity of the agents which we used to have earlier. So we are seeing more and more newer agents coming up. We are decreasing toxicity to the patient, and we are increasing the survival of the patient. So that is what the last 2 to 3 decades of treatment which has been invented in last 2 to 3 decades.
Sir, can you tell us about the role of biomarkers in the detection and treatment of lung cancer?
See, biomarkers are very important. They not only determine whether we have to treat the patient or not, but they decide that what drug has to be given to a particular patient, what agent has to be. So it is basically a tailored treatment now. So why it is done is that not only it is effective in the treatment of lung cancer, but it has reduced the toxicity also. So that's what these newer agents, the targeted therapy and immunotherapy has done. Particularly, these agents have come up in last 2 to 3 decades.
And sir, what are the new or latest modalities of treatment?
See, the latest modality of treatment you have to decide or divide into surgical treatment, the systemic treatment, and the radiation. As far as I am concerned, I am a medical oncologist. I will give you example of certain newer therapeutic agents like pembrolizumab, nivolumab. All these agents have come and they have improved the survival. These are the newer modalities of treatment which is happening.
So audience is eager to know about your experience of treating lung cancer patient in AOI.
Yeah, American Oncology Institute, at various levels, we are treating lung cancer patients. And here the treatment is little different from other centers because we are running international tumor boards. We are running our internal tumor boards. We are discussing all the patients amongst the consultants. And the advantage of this kind of a treatment is that we want to give best to the patient and we want to give the most scientific treatment. And the idea behind is to get improved survival of the patient with lesser toxicity, and there should not be any kind of a ambiguity as far as the treatment is concerned. So it is basically a precision oncology which is going on for the treatment of lung cancer, where we exactly decide what we have to do after discussing in international and our international and internal tumor boards.
Sir, is there entity like good or bad lung cancer?
Yeah, actually there is no entity mentioned in the literature as far as good lung cancer is concerned or bad lung cancer is concerned. But I will say I have made it through my experience. I divide on my own these lung cancers into good cancer. I will call a good cancer patient those patients, lung cancer patients, who have got biomarker or molecular marker positivity. Like if the patient has got EGFR positivity or ALK positivity, they are the biomarkers. Or patient has got any biomarker which has got some molecular targeted therapy or molecular immunotherapy. These patients, they stand better chance as compared to those patients who are biomarker or molecular markers negative.
So what AOI is doing for the treatment and detection of lung cancer?
We have got, first of all, I should tell you that we have got all the facilities for lung cancer treatment. In fact, all the cancer treatment, we have got all the latest facilities. We have got our chemotherapeutic agents, all the chemotherapeutic agents, newer targeted therapy, newer immunotherapy, the precision oncology, we have got PET scan, we have got good radiotherapy machines. That's very important in the treatment of cancer, because it improves the survival and gives least toxicity to the patient. So I feel that AOI is doing wonderful job all over the country. In fact, all the centers which are existing, they are doing wonderful job at present.
So, sir, in the last, your message to young generation about lung cancer?
See, I cannot give any message to anybody, but I can give message to myself. And that message is a silver lining. See, I'll give you an example, like if it is raining, you look for a rainbow. If it is darkness, you look for the stars. And if somebody is diagnosed with a cancer disease, the silver lining is that the patient who has been diagnosed, he looks to the doctor. That is his hope. And I always tell myself, and I tell others also, that spend maximum time with the patient. Your patient is like a patient, the relations you have got. Your relationship with the patient should be good. At no stage the patient should feel hurt. You give maximum time to the patient, listen to him, talk to him, and give your best. That is the message which always I give to myself, and I try to follow up as far as possible.
Thank you, Dr. Dhar, for the informative session.
Thank you very much. It was a very, very wonderful kind of an interview, and I have gained a lot of things from this interview. Thank you very much.